Our next speaker is Dr. Faria Rizvi. She is Specialist Registrar in Diabetes and Endocrinology at St. Bart's, London. She is going to speak about insulin prescribing and safety in the NHS.
Hi, morning everyone. Thank you very much to APPS UK for the invitation to speak. It's an honour to share the panel, to share the stage, with so many illustrious colleagues. So my talk is a brief talk about insulin prescribing. I'm a diabetes and endocrinology and general medical trainee in London. And this really affects across all specialities, general practice, tertiary care. So I'd be interested to hear everyone's remarks. So if we start with some typical statements. So a statement from a junior doctor. He says, so regarding patients, they come in and don't bring their insulin. I'm guessing some of the time, and I'm scared that I'll get it wrong. I don't know the pens and can't remember all of the insulins, and we're all nervous about it. And then he describes one patient who had 3 different types of insulins in her bag, so he didn't have any idea of what she was actually taking. Similarly, a typical GP statement, I don't know what dose they're on, so how can I prescribe the right amount on their repeat prescription? Patients often tell me completely different doses after coming out of hospital. And similarly, from a pharmacist, a patient had been taking the wrong dose of insulin. The previous prescription was of that for an insulin mix, and now she was given Novorapid by mistake. So does anyone want to hazard a guess what this is? So this is taken from a typical drug chart. Yeah, so it's guess. So it's a typical sort of ambiguous prescription that you might see on an inpatient drug chart, for example. What about this? What does everyone think this is?
Guess.
60.
Yeah, 60 units of insulin.
6 units.
And this? 31.
All ambiguous.
Yeah, so it's really ambiguous, isn't it? And as I'm sure, I don't need to tell my esteemed colleagues, obviously, that incorrect and ambiguous insulin prescriptions can have very far-reaching effects. So insulin is included as one of the top 5 high-alert medications, along with opiates, injectable potassium chloride, intravenous heparin, and more concentrated sodium chloride solutions. So I'd commend this paper to all of you. It was published in 2010 in the BMJ, and it's specific to insulin prescribing and how to avoid errors in insulin prescribing. So along with that paper being published in 2010, the National Patient Safety Agency, which we've heard a lot about over the last day and a half, issued a rapid response report about the safer administration of insulin. And the report highlighted the errors in the admin of insulin by clinical staff and how common it is. And in certain cases, this can be severe enough to cause death, as I'm sure you could all appreciate. So some specific figures. Between August 2003 and 2009, the NPASA received almost 4,000 wrong dose incident reports regarding insulin only. And these included 1 death and 1 severe harm event due to the 10-fold dosing error from the abbreviation of the term units. So this goes back to our first few slides. 3 deaths and 17 other incidences were also reported over a 4-year period between 2005 and 2009, where an intravenous syringe was used to measure and administer insulin, which should, as I'm sure you will appreciate, should never happen. So the National Diabetes Inpatient Audit is a yearly audit conducted by your hospital's diabetes team. So last year, in 2016, 38 patients included in the audit had experienced at least one diabetes medication error whilst in hospital. So I'm sure you'd agree that that's really not acceptable. That's almost 40% of patients. And these errors can be of two types. The first is a prescription error, where the medication is prescribed incorrectly in the drug chart or the notes, or given at the wrong time. The second type of error is where the insulin doses, for example, are not adjusted in response to the blood sugar. I'm sure you'll appreciate in hospitals patients can have a very different blood glucose profile to when they're not in hospital due to being unwell, being fasted, pre-op, post-op, etc. So the incorrect dosage incidents were related to incorrect prescription, abbreviation of the term of units, poor handwriting, which a lot of doctors are afflicted with, incorrect dose adjustment, which we've already discussed, poor documentation, duplicate dose administration, errors in calculation of doses, or incorrect programming of pump devices, for example. So this is just a pictorial representation of the NADIA, National Diabetes Inpatient Audit, evidence that they found last year. So if you see here, 1 in 5 patients experienced at least one prescription error, 24%, so 1 in 5 experienced a medication management error, and almost a quarter again, sorry. Whoops. Oh dear, what's going on? It's taken on a mind of its own, sorry. Oh no. Let's try again. Just on the last slide. Okay. So I'd commend this report to you all. It's very quick and easy to read, and it has some recommendations towards the end as to what to do. It recommends insulin prescribing courses for our junior doctor colleagues, diabetes management, insulin. Oh dear. It recommends patients carrying insulin passports. I think I have to leave it there. Patients carrying insulin passports, so doctors know in the community and in hospital what sort of insulin they're on and the doses, and better access to inpatient diabetes specialist nurses and diabetes team. So moving on from this, this is some research that we did last year and presented at Diabetes UK, understanding obviously as a diabetologist how difficult it is to manage correct insulin types of insulins, mixes, long-acting, fast-acting, rapid-acting, etc. So we commissioned a survey for junior doctors, consultants, middle grades across our trust, and it showed how much confidence most doctors lack in adjusting insulin while patients are inpatient. And we use this evidence to commission a specific insulin prescribing module at our hospital. And we're in the process of closing the QI loop. So many thanks. Sorry for the technical issues. Thank you very much.